I call Todd Barclay.
Thank you, Mr Speaker. It's a privilege to speak in support of this bill. And before I start, I want to acknowledge the Health Minister, Jonathan Coleman, the Commissioner who's been appointed and her team, Cathy Grant, and the Health Select Committee for facilitating this bill through the Select Committee process. I think just listening to all the contributions that have been made so far by the Labour Party, the Green Party, New Zealand First, if the biggest single issue in health in Southland and Otago is the quality of the food, then it really shows how out of touch they are with their constituents down there. I've been meeting with constituents from across my electorate, from across Gore, Balclutha, Winton, Queenstown, Te Anau, Lawrence, and the state of the food has not come up at all. What they're focused on is the optimistic opportunities that they see with the Commissioner and her team coming into place to reform and reconfigure how healthcare is delivered across Otago and Southland. There are systemic financial issues that have been facing the DHB, which is actually brought about by the poor mismanagement that the Labour Party did under the health portfolio over a decade ago. That's why we're here. That's why the Minister of Health, Dr Jonathan Coleman, had to put in a Commissioner to reform healthcare in Southland and Otago. We want more faster, effective, efficient patient care. We want a more sustainable financial organisation, and we want to reconfigure the systemic failures across the DHB and across the facilities, Mr Speaker. There are a number of hundreds of highly effective, highly passionate doctors, nurses, care specialists across the district who are putting a lot of faith in the abilities of the Commissioner and her team to be able to reform the health system in Otago and Southland. And I know that the Commissioner and her team are getting out and about. They're holding walking in your shoes sessions with staff, walking in their shoes sessions with members of the public, and I'm holding a number of constituent clinics as well. And what is broadly coming through quite clearly is a sense of optimism that this government's decided to take a stance and make a change to reform how healthcare is delivered here. Claire Curran's comments, I think, are out of touch around the food. So is so are Rhea Bond's, Mr Speaker, and I don't think they're an accurate representation of the people of Southland and Otago's views around health. And I think it's actually quite misleading, and it's not fair on our district. We've got an opportunity to be able to restructure and reform, and I want to acknowledge the Commissioners. I meet with them or talk to them regularly, and they are listening to people. They're passionate about what they're doing, and I think as they start forming a plan, we'll start to see more information coming through, and that'll be starting to be communicated with the community. And each step of the way, there is community consultation. So for the Greens to say that we need to do it a complete about-face and disband the Commissioners and have local elections this year would just put at risk, and it would totally destroy all of the hard work and effort that's already gone into reforming the Southern DHB, Mr Speaker. So in closing, I just want to reiterate my support to this bill, the support of the Minister, the Commissioner, and all of the doctors and nurses and specialists across the region who are doing their best to reform healthcare for the better for Otago and Southland.